Hello students. In this video, we're going to be discussing what you need to know prior to your EKG and blood pressure physiology labs. To begin with, it's important to note that the labs will be carrying out two separate exercises simultaneously. Half of the groups will be working on EKG data, while half of the groups will be working on blood pressure data. Even though you may be working on different experiments, you are all responsible for all discussion questions and all elements of the lab exercise. To begin with, we're going to re-examine a basic EKG, noting, of course, that the blue tracing that you see here indicates electrical activity of the heart. Now, from the electrical events, we can infer the timing of mechanical events. And so it's important to recognize the relationship between those two electrical and mechanical events. As a quick review, recall that on the EKG tracing, you see a P wave, a short PR segment, a QRS complex, a short ST segment, followed by a T wave. You'll also see various intervals associated with this EKG, the PR interval, the QT interval, and the RR interval. On the most basic element of the EKG, you're just looking at the waves. So, of course, the P wave is associated with atrial depolarization. This is the electrical event that immediately precedes atrial systole. Atrial repolarization, demarcated by that QRS complex, is the electrical event which immediately precedes atrial diastole. The ventricular depolarization noted during the QRS complex is what immediately precedes ventricular systole. Now, since ventricular events are the driving forces behind cardiac output, you do actually see the timing of those mechanical events mapped out here on top of the tracing. Again, the tracing doesn't actually tell you where these mechanical events occur, but from what we know about cardiac activity, this graph is actually showing you where that overlap occurs. So ventricular systole begins here in the middle of the QRS complex and lasts about partway through the T wave. Ventricular repolarization, as demarcated here by the T wave, is going to be the electrical event which precedes ventricular diastole. Again, mapped out here, leading from about halfway through the T wave, through the TP segment, until the middle here of your QRS complex of the next cardiac cycle. It is important, again, that you recognize all these elements and what they stand for. Finally, of course, is the isoelectric line. So this is that midline that you see. And the idea here is this denotes times whenever there is no electrical activity being recorded by these electrodes associated with the EKG. Now, in your lab manual, you will see a table that defines what's happening through each of the individual waves, intervals, and segments. It is important that you know what that measurement area is and what it represents for your lab quiz and your lab practical. It's not important that you know the average duration in seconds of each of these events. And being able to identify each one of these is going to be very important for the analysis of the data that you collect. So you will be analyzing EKG readings obtained from students in your lab groups this week. You'll be using an I-beam cursor on a software program to actually select specified regions of the EKG. So this table, again, is describing the measurement area that you'll be selecting, but you're welcome to continue to reference this tracing contained in the front page of your lab manual. One thing to note is that a single cardiac cycle can be indicated by the R to R interval. And that, of course, is going to be written here as the time between two successive ventricular depolarizations. But as you can see once again here, this is going to be measurable from the tip of the R peak of the QRS complex in one cardiac cycle all the way here to the R of the QRS of the next cardiac cycle. So at any point in time, if you're asked to measure heart rate by looking at a single cardiac cycle, you can just use your I-beam cursor to measure from R to R. These are the most easily readable regions within a single cardiac cycle. In preparation for the lab, you will start by assigning roles to student in each lab group. You need a student who will be the subject for EKG measurement. You need a computer operator. You need a reader who can basically outline the steps of each element of the exercise out loud to the lab group. And you need at least 2 students assisting the subject at all times, making sure that they transition from one condition to the next, making sure that their EKG wires don't actually cross, and that those electrodes don't pop off. In preparation, the student who will be measured needs to actually have the skin for the electrode placement clean and abraded. Make sure you use soap and water to remove oils from the skin. We will also have alcohol pads that you can use to abrade and clean the skin. Remove any jewelry on or near the electrode sites. You'll place the electrodes directly on the skin, following directions on page 5.3. If the electrode is dry, you can apply a drop of gel, and this is a very small eraser size amount of gel. For optimal contact, leave the electrodes on the skin for at least 5 minutes before you start calibration. And this is advantageous because you also want the student to relax in the supine position, lying down on the table for 5 minutes before this calibration. So the timing works out well. For the data collection you take place, carefully follow the protocol on pages 5.3 to 5.5, relying on the reader in your group to lead you through each step. You must calibrate the software at the very beginning and have your instructor check this calibration data before you move on. You'll click Redo at the bottom of the page to redo calibration if necessary, but if your calibration is good, you can click Continue to move into the actual exercise. Just a few tips for data recording. Make sure the subject's arms and legs are relaxed as they take their data. Any movement that they generate will actually throw off the tracing recordings within the software program. Again, this requires them to remain still, and it also means they shouldn't be talking at all. Make sure the electrodes don't peel up and the leads don't pull on the electrodes. This is where your assistants throughout the exercise are going to be watching at all times. You'll be recording in 4 conditions. In the supine position, again, your subject should be laying still in supine for 5 minutes before you begin recording. The next condition will be the seated position. Now, this should be done very quickly. Make sure you've read the steps of this part of the exercise before actually going through it. You want to catch the heart rate as early as possible as soon as that subject is seated. So they'll be in the supine position for 5 minutes. You'll obtain that reading. And then as soon as they move to a chair with both feet flat on the floor and they are still, you'll immediately begin to collect more data. So again, the earlier you can do this, the better your data will be. Once you finish this, you'll move on to deep breathing. It's important here that you watch the subject as they breathe in and breathe out. They shouldn't be talking. You should not be talking to them. Instead, you'll record each inhalation and exhalation by pressing F4 at the start of each inhale and F5 at the start of each exhale. This is going to mark the tracings collected in your EKG, and you'll come back to them when you do your analysis. The final condition is a recording post-exercise. Your subject will take off the leads, but will leave the electrodes in place for this time, and they can jog up and down the hallway, they can do push-ups, they can do jumping jacks. They just need to get their heart rate elevated for a couple of minutes. You again want to make sure you start your recordings very quickly after they come in from exercise to get the most accurate data. Now, other groups within the lab will be utilizing blood pressure measurement. So there's 2 methods of blood pressure measurement, one of which is the auscultatory method. And this is the method that requires you to hear the sounds of blood flow in order to indicate appropriate pressures. This requires the use of a stethoscope, and that stethoscope will monitor changes in blood flow, and those sounds that they're monitoring are known as the sounds of Korsakoff. The idea here is that blood that flows through a completely closed or a completely open vessel will be silent. So whenever you inflate a blood pressure cuff, also known as a sphygmomanometer, that's going to completely constrict the vessel and restrict blood flow and stop it. And so at the early onset of this process, blood flow would be silent. However, as you reduce pressure in the cuff and slowly restore blood flow through the artery, you'll find that blood flow is turbulent as it's being restored, and it produces sounds of Korsakoff as it bounces off the wall of the vessel. This continues until the vessel's pressure has been completely eliminated, and it goes back to silent blood flow. The first sound that you hear whenever you've constricted that vessel and begun to release pressure is going to indicate the systolic pressure of blood flow, mimicking the pressure achieved as blood leaves the ventricles during ventricular systole. The silence that you hear after the last sound is going to indicate diastolic pressure, the pressure of blood within vessels during ventricular diastole. You are responsible for knowing how to obtain a manual blood pressure measurement, although you may not be expected to actually obtain these measurements in lab. Now, as you're going through the steps of blood pressure measurement, it's important to know what the values you're actually collecting mean. So, of course, you're collecting systolic and diastolic pressures using the sounds of Korokov. Now, these pressures themselves can be utilized to determine what's known as pulse pressure. And pulse pressure is measured as the difference between systolic and diastolic pressure. And based on the values you have, you can compare those to the normals and the pathologic indications for blood pressure. You can find this table in exercise 5 of your lab manual and should have these values memorized. Normal or average blood pressure is a systolic around 120 millimeters of mercury with a diastolic of about 80 millimeters of mercury. You'll also be expected to know how to calculate mean arterial pressure. And that can be done in a number of ways. 2 example equations are provided here, just as they are in the lab manual. Mean arterial pressure is the best indicator of what drives blood flow through the body, and you can utilize this equation, taking pulse pressure divided by 3, plus your diastolic pressure to help you calculate that. We will be expecting you to take data on a lab quiz or a lab practical exam and actually plug it into one of these equations. So have the equation for pulse pressure and the equations for mean arterial pressure memorized prior to taking your lab quiz or your lab midterm exam. For data collection, the groups will divide up in a similar way to the EKG groups. You'll have someone who is a subject for blood pressure measurement, not for EKG measurement. You'll have a director in the group who manages the blood pressure cuff and will be measuring pulse at the same time. You want a reader who can actually lead the group through the exercise, and 2 or more students to assist the subject in the process. The guidelines for the subject is that they must not have had any disorder, hypertension, heart surgery, stroke, or any history of cardiovascular degeneration for any of these exercises. It's best if they've not consumed caffeine, smoked, or performed heavy exercise within 1 hour of the recording. Much like what we see with the EKG measurement, have them seated and still for 3 to 5 minutes prior to the recording. Their hands should be relaxed and not clenched, and during measurements, the arm should be positioned at the heart level. Sometimes this requires the use of a textbook or a pillow to elevate the arm where it needs to be. The first thing you should do is practice obtaining a pulse using the radial artery. After you've found a pulse, you want to count the number of beats you feel over 15 seconds, and then multiply that value by 4, and that's going to give you the number of beats per minute. And this pulse, of course, is indicative of heart rate. Obtain the pulse on the opposite wrist of that being used for a blood pressure measurement all through this exercise. Remember that between measurements, you should allow your subject to have a 5-minute recovery period before using the same arm. If you've had a mastectomy, you should not volunteer to be the subject in these experiments. The 4 conditions you'll be using for blood pressure measurement are right arm seated, followed by left arm seated. Then you'll move to right arm supine. Make sure that that individual is in that supine position for about 5 minutes before recording. And then you'll do right arm after exercise. Again, exercise is up to the subject's preference. You just want to make sure their heart rate is elevated, and then you want to make sure you take that measurement as quickly as you can once they've come in from exercise. Once you've obtained your data, you'll be actually working in groups to analyze the data, following the questions in the tables that are outlined in exercise 5. The instructor in lab will assist you with your analysis during lab, and then will give the groups an opportunity to share analyses at the end of lab. Your exit quiz in lab this week, as well as the midterm lab exam, will be short answer format. So it's important that you know how to explain the data that you get and how that data is analyzed. Please make sure that you practice describing the analysis and get any questions that you need answered in lab with your instructors and your TAs. Good luck in preparation, and we'll see you in the labs.